In terms of her treatment, I would say that the treatment of HER2 positive breast cancer is one of our greatest success stories in oncology, starting with the approval of trastuzumab, followed by several other agents that target HER2. We've dramatically improved survival for these patients. So this patient was treated first line with the CLEOPATRA regimen, which consists of a taxane, trastuzumab, and pertuzumab, based on really impressive improvements in progression-free survival and overall survival demonstrated in that study. I would comment that I would have probably tried to get approval of Abraxane or nab-paclitaxel in this setting just because she was diabetic, and that would have afforded the opportunity to not give her steroids as a pre-medication. Second line treatment with the antibody drug conjugate trastuzumab and tansine or TDM1 is also pretty standard based on the results of the EMILIA trial. So I would say this patient's treatment course was quite typical in the first and second line setting. So there are many factors that influence our treatment recommendations in the first and second line setting. In terms of how this patient was treated, I would say that many patients can receive treatment in the first line setting with a taxane for about 4 to 6 months before toxicity issues start to become apparent. In this case, it was stopped for neuropathy. In the situation where there's an option to start hormonal therapy in ER positive, HER2 positive patients, this is usually done in this setting. This patient didn't have that opportunity because she had ER negative disease. Our decisions in this setting are informed by what treatments patients received in the adjuvant setting, any persistent toxicities from those treatments, disease burden, and of course, patient preference. So in this case, because the patient had de novo metastatic disease, she was symptomatic with pain, she didn't have the option for hormonal therapy in conjunction with HER2 targeted treatment, I would say the decision-making was pretty straightforward. In terms of what's coming, there are several important studies that may change what we do in the first and second line setting. For example, in the second line setting, there's an ongoing trial looking at trastuzumab deruxtecan or DS8201 versus TDM1 trastuzumab emtansine, again in the second line setting. In the first line setting, there is a study that's ongoing by NRG looking at the addition of immunotherapy in combination with the taxane, trastuzumab, and pertuzumab. Of course, these are ongoing studies that have not reported out yet, so our first and second line treatments are pretty standardized at this juncture.